To truly appreciate the enduring influence that Thomas Bashore has had on the training of future cardiologists at Duke, consider this. In 1978, as an associate professor in cardiology, he won the inaugural Eugene A. Stead Award for excellence in teaching. And just this past spring, some 37 years later, he won the award again.
If I do anything differently as far as teaching and things, I always try to make it fun. We always laugh on rounds, we have fun on rounds. When I see patients, I always try to make it fun because I know they're scared to death.
As director of the Cardiology Fellowship Program for 12 years, his humor, empathy for patients, and generosity, he often treats his trainees to coffee, endeared him to generations of future cardiologists. He has won more teaching awards from Duke, UNC, and Ohio State than there is room on his office walls. He won the Duke Cardiology Fellowship Teaching Award so often, it was renamed in his honor.
You can get them enthusiastic about medicine, about cardiology, about their careers. Then you've really accomplished something and you've left a legacy that's worthwhile.
Bashore stands out equally for his clinical work, which has earned him multiple committee positions on the American Heart Association and the American College of Cardiology. He has co-authored many of the guidelines for evaluating and treating cardiovascular diseases and has been on the editorial boards of every major cardiovascular journal.
The heart was just the coolest organ there is because it had electrical system, it had a mechanical system, it was related to function all the time, it had chemistry involved with it. It's where your soul is, and you wouldn't have Valentine's without a heart.
Bashore has been a pillar of the Duke Division of Cardiology as a founding member of the Duke Heart Center. He launched the Duke Mobile Cath Lab, the Valvular Disease Program, and the Adult Congenital Heart Disease Program, all of which are now among the nation's best.
It really evolved fairly quickly, and it was just a lot of fun. It had wonderful people to work with, and I think that's true throughout Duke.
A fascinating hobby of his is collecting medical antiques and quack gadgets and potions.
See into the future. I know.
Anything you can imagine, including cigarettes that tout to cure asthma.
And a lot of these still function. Some of them still work. They still can shock you. They still can purge you if you wanted to be purged.
He also curated the History of Duke Cardiovascular Medicine hallway display. And he dabbles in art and has created illustrations for many of the 200 peer-reviewed articles he's had published. His favorite way to relax is fishing.
Several times a year, we have a group of us that go out fly fishing and just be silly for a whole weekend.
He and his wife Jill have 3 children and 5 grandchildren. When he first came to Duke in 1975 for a cardiology fellowship, his sports alliance was solidly in the Carolina camp, where he performed internship and residency.
When I came here, actually, I was a very obnoxious Carolina fan, and I am now a very obnoxious Duke fan.
After nearly 40 years of excellence at Duke, there really is only one thing left to say.
Thank you, Dr. Bashore.